Okay class, today we're gonna talk about dysentery.
Bro, this class is so boring, man.
Yeah, man.
I'll just sleep.
Ay.
Where am I?
You're at Intramuros, amigo.
Who are you?
Why, I am Dr. Chico. The walled city of Intramuros, a historical landmark, which was once the seat of power, allowing Spain to govern 7,107 islands for over 300 years. In time, education allowed the modern ideals of liberalism to penetrate the collective consciousness of the Filipino people, leading to the rise of nationalism and in all levels of society.
Yeah! I remember this place from a book I was reading. A brotherhood called Katipunan then led the assault that drove the Spanish out of the country. However, this was only the beginning of a war against yet another power. The Americans who helped relieve the Spanish hold were the same Americans who used their advanced military equipment to seize power and force the Filipino army to retreat to the provinces.
That's right, Chino. And as resistance subsided, the initial military government was then replaced with a civil government, which shifted focus to urbanization, allowing different establishments and modes of transportation to be accommodated by the city.
Not to be rude or anything, but what the heck am I doing here?
I'm glad you asked. You're here in Intramuros to learn about dysentery in the year 1902.
1902? How is that possible? How did I go back in time?
Never mind that. Don't you want to know what they found out by focusing more on urbanization?
Not to be rude again, but
Great!
as different aspects of urban living were improved, it became clear that there were many more issues to be addressed, some of which were even caused by these advancements. Would you like to know what kinds of issues?
Fantastic! The increased production and consumption brought about by the heightened affluence contributed to environmental degradation, particularly in Manila Bay. Urban living areas also lacked sophisticated waste disposal systems.
Sounds like this place had all kinds of problems back in the day.
Yes, it did! One such health problem during this time was dysentery.
Dysentery? What's that?
Why, I'm glad you asked.
Dysentery is an infection of the intestines that causes diarrhea containing blood or mucus.
There are two main types of dysentery, bacillary and amoebic. Bacteria such as Shigella cause bacillary dysentery, and parasites such as entamoeba cause amoebic dysentery.
Oh man, that sounds like it sucks. I'm glad I don't have to worry about it.
Yeah, it does. And yes, we are both lucky that it is not a big problem in this area anymore. Why don't I explain to you how you can avoid this infection wherever you are?
Gee, that'd be great. But I don't want to waste your time.
Nonsense! I have all the time in the world. Here's what you have to remember. Eating undercooked food is one of the ways someone can contract dysentery. Alcoholism, poor nutrition, pregnancy, and meditation are all factors that weaken our immunity and are considered risk factors for contracting this disease. Consuming untreated water or having direct contact with an infected individual can also lead to someone contracting the infection. These, along with poor hygiene and sanitation, are the main ways of contracting this disease.
So, how do you know if you have dysentery?
Let me tell you more. So, the most common symptom of dysentery is having watery loose stools which contain blood, mucus, or pus, though further investigation must be done to confirm the presence of the pathogen. Other factors such as abdominal pain, fever, nausea, vomiting are also associated with the disease. Complications may also develop such as abscess of the liver, brain, and lungs, anemia, and chronic dysentery, which can be fatal.
So, what did the people do to prevent it?
Prevention of this disease is mainly done through proper hygiene and sanitation. Though in endemic areas, avoidance of raw and untreated food is recommended. Treatment, on the other hand, is done by consumption of oral fluids to avoid dehydration, ingestion of paracetamol for pain and fever, and loperamide for diarrhea. However, in severe cases, a short course of antibiotics may be necessary to eradicate the infection and prevent the disease from returning or recurring.
If that's how dysentery works, how badly did it hit Intramuros?
Well, there were a few sporadic cases which heightened incidents in 1922, but there weren't enough for it to be classified as an epidemic. In fact, there were no epidemics of dangerous communicable diseases in that year. In the whole city of Manila, there were reported 250 cases of dysentery with 146 deaths, 22 of which were deaths of transients. In the district of Intramuros, there were only 24 reported cases with 7 deaths.
The greatest reported number of deaths was in the month of July. This may be attributed to the end of the dry season, during which the risk for dehydration is particularly high. Cases, on the other hand, were greatest in number in the month of August. By this time, the wet season was well underway, and as such, the transmission would have been more easily facilitated. Dividing the population into categories, there were a total of 60 male and 53 female Filipinos, 4 Americans, 1 Spaniard, 3 Chinese, and 3 other nationalities, with a total of 124 dysentery deaths. In terms of age, deaths were highest among children. There was a total of 69 deaths from ages 1 to 9. 30, which is almost half, were among children aged 2 to 4. The most number of deaths are found in ages 2 to 4 years with 19 males and 11 Filipino deaths. Close to this are those from ages 5 to 9 years with 12 males and 7 female deaths, and those around ages 1 to 2 years with 10 male deaths and 10 female deaths. Was it always like this?
Well, in the years leading up to 1922, the city of Manila saw a steady decrease in its incidence and mortality. So you can just imagine how much worse it was before. In 1921 to 1922 alone, incidence per 10,000 people decreased from 12 to 8.3, while mortality per 10,000 population decreased from 6.2 to 4.1. Wow.
How did this happen? Did the people find better ways to cope with the risks on their own?
The people had a lot of help from the government. There were various health measures conducted by the Health Service Bureau. To minimize transmission, they conducted rat extermination, ordered the cleaning of stables, disinfection of refuse clumps, prohibited serving drinking water in sari-sari stores, and hand scraping of ice served in refreshments. Aside from this, the Americans were already big advocates for public education, so it wasn't difficult to integrate improving sanitary practice into the curriculum.
You mentioned that the pollution of Manila Bay and the surrounding bodies of water played a part in this. Did the government do anything about them?
Yes, of course. The same agency performed biological examinations on the water supplied by water companies back, such as Metropolitan District, with its supply coming from the Marikina and Montalbano rivers. Aside from these, analyses were also conducted on the water from artesian wells and public establishments. Over 1,000 samples were collected in Manila alone.
Almost 20% of these were classified as unfit for drinking. In Intramuros, however, over 600 samples were collected, and almost 25% were unfit for drinking. Sanitary reports were also made more comprehensive to account for more risk factors associated with dysentery. The data gathered in 13 days by 44 inspectors paved the way for almost 10,500 corrective actions. Over time, Intramuros saw a decrease in the number of places with improper handling of water by 60%, the number of places with defective or no disposal of refuse by 50%, and the number of mosquito breeding grounds by 20%. Wow! That's great! It's amazing how the work they did made such big changes. As much as I'd like to believe that those interventions directly contributed to the lower incidence and mortality, we can't jump to conclusions. Consider the case of typhoid fever. It also existed in both amoebic and bacillary forms. It was also an intestinal infection, and at one point of entry was also oral. That means that the conditions that aggravated dysentery cases were likely to have been the same ones that aggravated typhoid fever cases. A large inconsistency exists in how dysentery declined, but typhoid fever can still be observed today. Whew! It's been a tiring day. Let's sit down for a while. Oh, so dysentery is still a problem here in the Philippines? Unfortunately, yes, it is. As dysentery is transmitted through water, which is contaminated with human feces, it is most common in areas with poor hygiene and sanitation. Outbreaks are very common in evacuation areas after typhoon or storms, where people are crowding in the evacuation centers. Their source of water is most likely contaminated due to the congested living space and the poor hygienic practices of the people in the area. Why won't the government do something to prevent the spread of this infection? Well, it is. There have been many interventions made by the government to alleviate the problem. Oh, like what? Programs on hygiene and sanitation for starters. Raising awareness on the importance of proper hygiene is one of the most important things the government could have done. People need to know that to have proper hygiene, along with knowing why it is important, before we can expect them to actually do it. A program of the Department of Health focuses on proper hygiene through hand washing education and is made especially to understand so that even children can develop this practice. Come, let's move on. Just telling the people how and why will not solve the problem. What about for the people who already have the infection? Well, there have also been developments in antibiotics as a cure for dysentery. Ciprofloxacin is the first-line antibiotic remedy for bacillary dysentery, shigellosis, for all ages. Redora is another drug that helps fight amoebic infections that can cause dysentery. There have also been curing methods that have recently arisen in order to alleviate the symptoms of both kinds of dysentery. Rehydration therapy is a great example of one of these remedies, wherein the patient is highly encouraged to drink plenty of fluids. Because vomiting and diarrhea leads to substantial water loss in the body? Yes! This therapy helps the patient avoid dehydration. So, I get that it is still a problem, but has there been any other big outbreaks since the 1920s? Well, there have been several outbreaks in different areas throughout the years. One of these outbreaks was in an evacuation center in Tacloban after the Typhoon Haiyan in 2013. More recently, there was an outbreak in an evacuation camp in Maguindanao as 2015. Cramped shared spaces allow for easier contamination of their water supply and therefore result in outbreaks. If you take the proper sanitary precautions and watch where your water is coming from, you can greatly reduce your risk of getting dysentery and you will stay healthy. Wow! I've visited so many places and definitely learned a lot of things, especially about the history of the disease and how strong action was done to help stop it. It's great! that not only medical precautions were taken, but also those concerning the whole population, such as testing water sources and programs for awareness. But wait, what's that? Why is everything shaking?
Wake up! Chino, 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 wake up! So what have you learned today, Chino?
The two types of dysentery, amoebic bacillary, Shigella and entamoeba, the sources of this disease. Just look at the food around you, right there on the unmopped floor. Such dirty water surrounds you, and your immune system's poor. Dysentery, dysentery, inflamed intestines, albeit with mucus, bloody feces. Poor sanitation and hygiene, make sure your hands are always clean. Rehydration and oral no cure dysentery.